In review of last week and the COVID variant that we're starting to see that was first detected in January of this year, the NB181 variant, it's one of the Omicron variant, like we've talked about of the COVID virus being similar to flu and how it can have different changes of just what kind of proteins are on its surface. It's very similar COVID, but just slightly different. So whenever these things arise, which is also why it's a reminder, similar with flu and for COVID, that we want to make sure that we're getting our vaccine every year that is changing for the sake of the virus that keeps changing on its own. So these mutations they found are associated with increased transmissibility, which means that it can be transferred from person to person quicker. And it's become like a really big issue in Asia recently. 20 plus countries have been detected, including the United States and New York. Things to be very careful about and aware of and do whatever we can to prevent and to keep our own self and body and community safe by getting the vaccine is the biggest part, but also doing other preventive things that we'll review. Different symptoms that you can get from COVID and from this variant is very similar COVID symptoms that we've been seeing the last 5 years, which is like fevers, chills, congestion, difficulty smelling, loss of taste or smell being some of the big things. And I think for COVID symptoms, they feel very similar to common cold symptoms, but a lot more severe in some ways. Most people do feel like it's a lot more severe. Some people do have very much more of a light cold, but a lot of people will feel more severe symptoms than like the common cold. Remembering that vaccines are the main way to protect us from these illnesses and these variants that are happening that we don't know that much about. And then also for this variant, antivirals are still effective. So remembering that if you start getting symptoms before they get even worse, you want to start reaching out to your providers or finding a doctor that can prescribe you Paxlovid because you can only start taking that when you've been within 5 days of having symptoms. Otherwise, it's not really effective. But especially if you are higher risk, are over the age of 65, have any other comorbidities, heart disease or diabetes, or hypertension, you want to be able to just prevent yourself from getting in the hospital for any reason. So starting Paxlovid earlier is better. And just making sure you're vaccinated, especially if you're higher risk, because that's the main way to prevent yourself from being in the hospital. And the urgency on this was that the FDA may limit vaccine access to high-risk populations. We're seeing this in the current state of our government, a lot of changes, a lot of doubts being shed on vaccines and their effectiveness. And it's really dangerous to all of our patients. And there's a huge pushback from doctors and people that are caring about patients and the general health of the public of how this is going to really negatively impact our population. So we want to make sure, try to fight that misinformation that's being told to us from a lot of different angles now. And remembering that a lot of the people that are in charge of what we have access to are not really having the best knowledge around healthcare and medicine. It's a headline from yesterday of the CDC, Center for Disease Control. One of the experts in viruses and in COVID-19 specifically ended up resigning. And we've been seeing that for a lot of administration, a lot of healthcare professionals and people that are knowledgeable about vaccines and public health are resigning because they can't really tolerate or really do their jobs in the current state of how things are. Because of all these changes, a lot of people are trying to push now for vaccines to be less accessible to us. We want to make sure while we can to really go out and get our vaccines and get protected against things that may not be freely available for us. That's a reminder to definitely try to get vaccinated, especially for COVID. Also, when you go get vaccinated, to make sure you're up to date on all the other vaccines as well, and just making sure you get that as soon as you can. As much as we have our own body immune system and defense systems, there's constant microbes around us and constant things that we're coming up against. And your body is silently always fighting off a lot of infections and a lot of things that are coming into our system. But really, the main reason that humans are able to be around for this long, that we have such a longer lifespan than we did hundreds of years ago, is because of vaccines themselves. And then another reason, especially for us to vaccinate in New York City, is that there's higher risk of respiratory illnesses in the city. And that is because city air qualities in general, not just New York, but other urban cities as well, have poor air quality, but especially East Harlem, because we do have more bus depots and more pollution and higher asthma rates. There's higher risk for people that live in East Harlem. And then there's a higher risk specifically for Black and Brown people as well for respiratory illnesses. So making sure that we do protect ourselves as much as we can. The reminder of our respiratory vaccines, we have the COVID vaccine. If you haven't gotten a COVID vaccine since September of last year, then you're due for one. There's a 2025 vaccine that became available in early October last year. So if you haven't received that one yet, that's definitely something that you want to get. But this is the 2025 vaccine that's available. The flu shot, we're out of season right now, so you don't have to worry about that currently. Just remember that every August and September, you start thinking about the flu vaccine and asking your doctor if it's available yet, or your pharmacist when you go to CVS or Duane Reade and seeing if it's available. And then RSV, that's one shot. Hopefully everyone has gotten that vaccine now who's over 60 years old, but that's a really important one that we want to make sure that we get a shot for when you're over the age of 60. And then same with pneumonia, that's one that you'll get over the age of 65. And then if you are higher risk, if you have HIV or cancer, you want to check with your doctor because you may have to get that before you turn 65. Some of the other vaccines we don't talk a whole lot about because they're not respiratory related. HPV vaccine, the only vaccine that prevents cancer. Some of the other main ones to make sure you get as an adult is the shingles vaccine over the age of 50. Shingles is a very painful rash that can happen. You want to be able to get vaccinated against that earlier, like when you turn 50 ideally, because it can happen more commonly as you get older. And then the HPV vaccine, like I said, the only vaccine that prevents cancer, cervical cancer especially, and that you can get up until the age of 45. Previously used to be just adolescents and up until the age of 26 that you could get it, and now it's been extended to 45. So if you're younger than 45 and you are unsure or haven't gotten the HPV vaccine, make sure you ask your doctor about it. The tetanus vaccine, you need to get that every 10 years. This is a really important one to get just to prevent tetanus, which can happen from contact with certain metal and things, but you never know when the accident can happen, and tetanus is really severe, so you want to be able to prevent it. And this is a very long-standing vaccine. So if you're unsure, if you can see your records or ask your doctor for records of when your last tetanus vaccine was. And then for some people who are higher risk, like males who have sex with males and anyone who does anal sex, you should get the monkeypox vaccine. Make sure that you are vaccinated against hepatitis A and hepatitis B. That ideally you were vaccinated for as a kid, but you can get titers to make sure that you are immune to it. So titers, they're basically just measuring your immune response to see how your antibodies are in your body. If the vaccine has worked and you've developed the actual defense towards the viruses. There's a lot of vaccines that we give in the United States in childhood to prevent against MRS, measles, mumps, rubella, against polio, which feels like it's eradicated, but it is not eradicated. It's coming up in other countries currently from lack of access to vaccines. We're seeing measles, people opting out of the measles vaccine and seeing a bump in that. And that can affect adults too if you haven't been vaccinated. And if you're really unsure, if you've moved here from somewhere else after childhood and unsure of your records, I'd really suggest asking your doctor about titers, especially if you are a higher risk patient, just making sure you are immune to some of these. If you were born here, you've likely gotten all of your childhood vaccines, but especially if you are higher risk, it's no harm in asking for titers. That's a blood test to really see if you are immune to these viruses. Some of the big other vaccines that you want to make sure that you do get and that you are immune to. There are so many different viruses, so many different things that for decades and hundreds of years, really, a lot of these diseases been killing people a lot earlier than they do now. The vaccines are the whole reason that we don't see as much polio, especially in the United States, because there's so much access to it because you get it as a kid. The COVID and flu vaccine are different. Like, why are we getting it every year? Like we said, you have to get it every year because those are the two viruses that are changing constantly. The measles virus, the polio virus, those don't change the same way. So this is the whole reason that we want to make sure that we're actually getting that yearly boost for our immune system. And because there's really no hope in eradicating COVID unless we all do have these vaccines. Like we said, polio is still around. Vaccines don't make things disappear overnight. It really requires our bodies giving them the vaccine, giving them no space to live in and for them to die out that way or get like close to basically dying out. So that's the main reason that we really do want to vaccinate. And just a reminder of some other prevention things we always want to make sure we do, especially in the summertime as we're out a lot more, interacting with people more, and there's a lot more tourism in New York where people are bringing in their own kind of germs. So we want to just make sure we're practicing good hygiene, remembering hand washing should last at least 20 seconds and between the fingers, carrying hand sanitizer with you. So when you are touching surfaces that other people have touched before ingesting something or touching your body, you want to sanitize your hands. If you see someone coughing or sneezing, trying to keep distance from that, trying to find ways to have cleaner air, especially when the air quality outside is good, keeping your home ventilated and opening the windows If you have the capacity to have an air filter, definitely have an air filter. And then masking as well. And staying home when you're sick, masking when you're sick, having COVID-19 tests and testing when you're sick as well. Know that you're not going to spread anything. And then obviously the huge one that we always talk about, and we've talked about a lot already, are vaccines. In terms of where to go for your shot, especially for the COVID shot and the flu shot when it becomes available again, they're typically free at Duane Reade and at CVS. The main one's in East Harlem that you can get your COVID shot. And you could really just walk in and get it. The COVID shot's available to everyone. Duane Reade on 106th and 3rd. There's CVS on Lexington and 96th Street. In terms of getting other shots or getting your health care as well, Settlement Health, that's on 106th and 3rd as well, really right next to Duane Reade. And the Barica Neighborhood Health Center, that's on 123rd and 3rd. And then just asking your healthcare provider. And also when you do go to CVS or Walgreens, you can ask them about the shingles vaccine as well and the tetanus vaccine. Some of those may require insurance, but Medicaid covers all of that too. And I believe at pharmacies as well. So you can just ask them if they'll cover it. Just keeping track and finding out what vaccines you have had and keeping that in a document somewhere, even writing it down somewhere, like the date that you got it, so that you remember and that you could show your doctor as well. As always, you want to make sure you do have a doctor. When you are sick, definitely trying to have already established care somewhere. All of these take uninsured and Medicaid and Medicare. Sometimes it's really frustrating when you're on the phone and you have to wait a long time to actually get a hold of someone. Really just try to stick with that. Try to get in contact with one of these clinics and establish care, because it's really important to having a primary care doctor for these reasons. When you do establish care with these primary care doctors, there are oftentimes an application like MyChart or My Mount Sinai. These are applications on your phone where you can actually send direct messages to your doctor and tell them you're feeling sick and what you should do. Tell them you need a Paxlovid prescription because you tested positive for COVID and symptoms started less than 5 days ago. So you can try to establish that and take control of your health in that way. Remembering that long COVID can be really debilitating for a lot of people. There's the long COVID clinic at Mount Sinai that hopefully some of you that are having really long-term symptoms from COVID can get in touch with. If you do have it and you're, what's the point of getting vaccinated? Long COVID doesn't mean you're not going to get COVID again. That could also make your long COVID symptoms a lot worse. So really making sure that, especially if you have long COVID, you really do need to get the COVID vaccine and stay up to date with it, because it can just make things a lot worse if you do get COVID again. If you haven't had long COVID, that is wonderful. A way of preventing it, because it can really happen with these new variants as well, is getting the vaccine. Just a reminder that early voting started. So that's going to be early voting for different state and local elections and different positions, but especially for mayors, the big one people are talking about. And that is going to be from June 14th to June 22nd that you can do early voting. And that's specifically at these two sites, putting in your address on findmypollsite.vote.nyc. So you can see which one you would go to, but generally whichever one you live closer to, you'll likely be there. These are both District 8. The actual election day is June 24th. And those sites, it's going to be a lot that pop up everywhere, and you just walk around your neighborhood and find it, but you also can find it on findmypollsite.vote.nyc during that day as well. Making sure you get out and vote. The government is very frustrating and often feel like not hugely a democracy, but we are still technically a democracy. And so we want to be able to vote and have our voice heard as much as possible. You can vote on certain things and not every single thing if you're unsure, but you can look up while you're in the voting booth too, but looking up which candidates are there, what you value, you can always do that on your own too.